to the videotape series Manual Therapy, Biomechanical Assessment and Treatment Techniques. The series is intended to help the student of manual therapy practice the techniques of evaluation and treatment after leaving the classroom and the instructor. All of the techniques demonstrated are based on those taught on the courses offered by the Canadian Physiotherapy Association and the North American Institute of Orthopedic Manipulative Therapy. It is assumed that the viewer has the necessary knowledge of anatomy and biomechanics to understand the basis of these techniques, and the videos only concern themselves with the technical aspects of manual therapy and not with the underlying theory. While these tapes will be of use to any therapist learning manual therapy, maximum benefit will be obtained if they are viewed in conjunction with participation in the certification courses of the North American Institute of Orthopedic Manipulative Therapy, or the extremity vertebral courses of the Canadian Physiotherapy Association. Volumes 2, 3, and 4 contain information on the application of manual assessment and mobilization procedures for the spinal and peripheral joints. Volume 5 illustrates advanced techniques for the assessment and treatment of the TMJ, pelvic and costal joints, and the techniques of high-velocity, low-amplitude manipulation of the peripheral joints. Jim Meadows qualified as a physical therapist in England in 1972. He has received instruction in manual therapy from a number of authorities, including Dr. James Syriacs, MD, Rolf Lubeck, Cliff Fowler, and Earl Petman in England, Canada, and Norway. He passed the Canadian final examinations in manipulative therapy in 1982. He is, at the time this video is being made, a registered instructor and examiner with the Canadian Physiotherapy Association and the North American Institute of Orthopedic Manipulative Therapy. He is also chair of the Canadian Physiotherapy Association, National Education and Specialization Committees for Orthopedics. Presently, he is a graduate student at the University of Alberta and has been accepted on faculty as an assistant professor. Improvement in manual therapy is an ongoing process of which learning the basic theory and the techniques is only the first step. The theory must be constantly applied as each patient comes for treatment, and the techniques practiced consistently both on the patient and in study groups. It is only with experience that the manual therapist can practice with facility and competence. The purpose of these tapes is to assist the student of manual therapy in one aspect of the process, the learning of the techniques.
Hello there, my name is Jim Meadows. First and most importantly, thank you very much for buying this series of videotapes. I'd like to welcome you to Manual Therapy, Biomechanical Assessment and Treatment Techniques of the Musculoskeletal System. In order to reduce repetition of basic principles, I would like to go over these at this time. When stress testing, hold the stress for a length of time sufficient to gain an end fill, or to reproduce symptoms and signs indicative of instability. There is no magic amount of time to hold. An end fill will be obtained when the crimp has been taken up, and this will depend on the size and the thickness of the ligament and the age of the patient. A positive test is one where the end fill is too soft or there is an excessive neutral zone of joint range. Another positive, particularly for the craniovertebral joints, is when the instability adversely affects a sensitive structure. For example, where the vertebral artery is constricted and ischemic signs and symptoms result, or where the dens compresses the spinal cord. The presence of cardinal signs or symptoms indicates compromise of the central nervous system. These signs or symptoms would include quadrilateral or bilateral paresthesia, hemiparesthesia, with or without contralateral hemifacial paresthesia, nystagmus, dysphasia, hemianopia, diplopia, lip anesthesia, or proprioceptive loss, or anything else that may be attributable to the central nervous system. With mobility testing, it is necessary to first test the passive physiological movement, and then the arthrokinematic if the former is hypomobile. This will help differentiate the end fill and help establish the type of hypomobility, whether it be myofascial or articular. If there is excessive motion on physiological movement testing, then stability testing is indicated. When testing for mobility, the range of movement and the end fill are ascertained, as well as when the pain comes on in relation to the onset of tissue resistance, as this will help determine the acuteness of the condition. From these mobility tests, it should be possible to determine whether a state of hypomobility or hypermobility exists, and whether the particular state is symmetrical or asymmetrical. When mobilizing a stiff rather than a painful joint, each barrier to the movement must be addressed as it arises. In general, the first barrier will be muscle, and this can be relaxed with hold-relax techniques, followed by pain barrier, where grade 4 oscillations are used, and then the articular barrier, where a prolonged stretch or a grade 4 plus technique can be employed. After the mobilization technique, and before moving out of the new range, the muscles need to have the increase in range pointed out to them. This can be achieved by a few isometric contractions to the agonists and the antagonists in the newly acquired range. This will help reduce the chance of improvement loss. As a further consideration, mobilization in opposite directions in the same treatment session will usually result in less improvement than if only one direction was mobilized. These points will be reiterated in the first segment of the vertebral tape, but otherwise only the oscillation will be demonstrated in the remainder. Before going on to the techniques, I would like to thank my two models, Beverly Perot and Nora Falt. I thank them very much for agreeing to put themselves through the agony of this particular exercise. I also would apologize to you for the agony of going through this introduction at the beginning of each tape. But I hope you enjoy these tapes and that they will help you in your endeavors in manual therapy. Thank you very much.